Hello, everyone. My name is Donald Duggan, and I'm the Director of Success and Housing Services here at HeartShare St. Vincent Services. Today, we'll be doing our makeup session for our December 2021 PYA workshop. And today, we're talking about health insurance. So I'm hoping that after today, after watching, after listening, you'll be able to know a little bit more about health insurance, know how it works, know why it's important, and know how your health insurance in particular works. So first and foremost, we need to know what insurance is, right? There's lots of different types of insurance. You may have heard about health insurance. Maybe you've heard about car insurance. Maybe you've heard about like home insurance, life insurance. There's all sorts of types of insurance, right? But what is it and why do we have it, right? So insurance is a means of protection against or protection from financial loss. It is a form of risk management, and it's used to protect your finances against the risk of something in the hope that it won't happen, right? So that sounds kind of weird. It's worded in a kind of weird way, but essentially you're protecting yourself against maybe a future event, right? So some examples of risks that are covered by insurance. Let's look at some examples. First one is a flood in your apartment ruins your furniture, your clothing, your laptop, your phone, right? Lucky for you, you have renter's insurance. So if you have renter's insurance, it pays for your belongings to be replaced, right? So in that instance, the risk is the damage to your property. You can't predict that, right? The flood could happen, something terrible could happen, right? So you get the insurance, you're paying for it, now, thinking that maybe in the future something may happen, right? And it will cover some of the loss, right? So it pays for your belongings to be replaced. Another example is, say you have a car. You're driving and your car skids in the snow. The car hits a tree, causing damage to your car, right? So in that case, auto insurance would be the thing. So all drivers are required to have auto insurance. That way, if an accident happens, the auto insurance company will cover some of that cost or all of the cost, depending on what the incident is. So in this instance, the auto insurance company is paying for the car to be repaired or maybe even possibly replaced. It may also pay for a loaner car in the meantime if your car's in the shop. So that's another example of insurance, right? In that instance, the risk is something that you can't predict is going to happen, right? You don't know if it's going to snow. You don't know if you're going to lose control of the car, right? So you're paying in the moment to protect yourself from unforeseen things that may happen in the future. Another thing, right? So you slip on the ice, you fracture your ankle, right? That would be health insurance. Your health insurance would kick in and it would help you pay for your ER visit or x-rays or surgery or doctor's visits or physical therapy or all sorts of different things that you may need support with. So again, in this instance, the risk is injury. Like you can't predict that you're going to fall. And so you're paying for, in the current time, in the present, for potential future damages or risks. So why is health insurance important, right? Health insurance helps provide protection for you, specifically financial protection in case you have serious accident or illness. So, for example, a broken leg can cost up to $7,500. And if you have health insurance, it can help protect you from a high unexpected cost, right? So many people probably don't have $7,500 sitting in their bank account just waiting for them to break an ankle, right? But if you have health insurance, which most people do, it will reduce that cost significantly. So you don't have to pay the $7,500 out of pocket. Insurance will cover most, and maybe you'll have to pay what's called a deductible, or maybe if you're going to the doctor, a copay. And listen, everyone listening to this is still relatively young. You may be thinking, I'm young, I'm healthy, why do I need health insurance, right? Maybe you are somebody who eats right. Maybe you're somebody who just is in good shape. Maybe you're somebody who is very careful. You don't think you're going to fall, right? Accidents and illnesses can be unpredictable and can happen to anyone at any time, right? Just because you're young, just because maybe you eat well, maybe you're fit, maybe you're careful, it still doesn't mean that you're protected from unexpected illnesses or accidents. And, if you have health insurance, it provides you that protection. And if you don't have health insurance and you have to pay for any medical debt, it can be really damaging, right? Debt is reflected in your credit report. It can make things difficult for when you're, applying for rent or want to get a car or a home or all sorts of different things. So we've done, PYA workshops around credit. So if you have any questions about credit, be sure to check that video out. We'll see if we can link it up in the top or something like that. Not really a YouTuber, so I don't know how this works, but we'll try to figure that part out. But yes, health insurance, incredibly important. You never know, when an accident may happen. You never know when an unexpected illness may arise. And so it's really important to protect yourself now. And so let's talk about how people get health coverage, right? Most people who work will get employee provided health insurance benefits. So what that means is usually the employer pays for some of the health insurance and the employee pays for the rest. So, oftentimes they'll leave the employee only covering a small cost of it, but they'll get a much better plan than if they just went to the market. There's also something called the Affordable Care Act. Most people know it as Obamacare. And that's the health insurance marketplace that people can go to if they don't have health insurance through their employer, where they can kind of shop around and figure out what insurance is right for them. There's lots of different choices. There's lots of different things that can be covered. So when looking at health insurance, it's important to understand, what's covered and what's not, because it's not like a one blanket thing where everything is covered automatically. And the last way that people get health insurance is through Medicaid. So that is actually a government health insurance managed by each state. It provides healthcare coverage to millions of Americans, including people who are low income, children, women, elderly, people with disabilities. Most people watching this video will have Medicaid. If you're in foster care, you often are eligible for Medicaid. It's something that you get automatically. But if you don't know what kind of health insurance you have, be sure to talk to your case planner or maybe your coach, and they can help you navigate that situation. And so let's talk about how actually health insurance works. Health insurance generally covers the cost related to medically necessary care. So this could be, primary care visits. It could be preventive care. So think about things like vaccines, screenings. Maybe it could also cover specialists. So maybe, you have some acne that you need to get taken care of, or you have, eczema or something going on with your skin. Maybe you want to see a dermatologist. That could be covered in your health insurance. Maybe your heart is, having some trouble regulating, or maybe, you've had some heart issues. You probably see a cardiologist. OBGYN is for, any sort of gynecology related needs. So there's lots of different kind of specialists, and many of them are covered to some extent in your health insurance. So you could always call your health insurance company and they can kind of tell you, what exactly you are eligible for. And you could also talk to your primary care doctor as well. Physical therapy sometimes is covered in health insurance. Labs, so say you have something going on, they need to draw some blood, blood work, urinalysis, TB tests, any sort of tests could potentially be covered in health insurance. Mental health services, so a lot of health insurance does cover therapy, counseling, chemical dependency help, things like that. Sometimes prescription medications and equipment can be covered. Emergency care, so say, God forbid you get hurt, you have to go to the hospital, that can often be covered. Vision, so getting anything done with your eyes, eye tests, making sure you have the right glasses, right prescription. Dental care, your annual checkups and your, if you have braces, maybe getting those taken care of. If you have a root canal you need, anything like that, may potentially be covered. And then one thing to keep in mind is each health insurance is different. So some will cover certain aspects, some will not cover other aspects. So it's really important when you are looking at your health insurance to look at, okay, what does this actually cover? And some things, like for example, specialists, you may have to have some prior authorization in order to get that service. So for example, say I was having issues with my heart, right? I may have to go to my primary care doctor first and get what's called a referral, or I may have to call my health insurance and say, hey, I need help with this specific thing, and then I'll have to be authorized before I actually go to that doctor. You can't necessarily walk into any doctor and say, I want help with X, Y, and Z. And so just one thing to look at, right, is what are you responsible for when it comes to your health insurance? So first of all, making sure that you have health insurance is something that falls upon each individual, but also things like premiums, deductibles, and copays. So those are the things that you have to pay in order to be seen by a doctor, right? So copay, you have to pay that in order to go to the doctor. It's usually a small sum of money, maybe $30, $25, whatever it is, depending on the health insurance, where you have to pay that, you get seen by the doctor, and then you're covered. Some health insurances don't have this. You're always covered. There's no copays, but others do. Same thing with deductibles and same thing with premiums. Right here, you'll see a copy of a health insurance card. Usually has things like your ID number, which is usually the SIN if you have Medicaid. The date it's effective, your date of birth, any sort of pharmacy that you go to, your primary care doctor. I'll have a bunch of numbers on the back, who to call for this certain thing. And then there is something that I do want to mention called a managed care plan. Essentially what that is it allows people who have this health insurance to see providers who are in network within your insurance. So, I don't know, you may have gone to the doctor, you may have wanted to go to the doctor, and you've heard that they don't take your insurance, right? That's the difference between in-network and out-of-network. In-network is doctors can say, I want to use this insurance and this insurance and this insurance, but I don't want to use this insurance. So what that means is, for managed care plans, you have to use doctors that are in your network. Okay, so you may be asking, okay, there's a lot of information here about health insurance. There's a lot of information about health insurance, companies. How do I know what health insurance I currently have, right? So with HeartShare's Infants and Services, if you are currently in care and you're up to the age of 21, you are enrolled in Medicaid Managed Care Plan. It could be Empire Blue Cross Blue Shield, it could be Fidelis, Health First, Metro Plus, United Healthcare, HIP/Emblem. It could be any of those plans. You're automatically enrolled. If you're having issues with the insurance, please talk to your case planner or please talk to your coach. They could certainly help you navigate that situation. But when individuals come into care, they're automatically enrolled into Medicaid. That way, if they ever run into any issues, they have Medicaid to help cover their health issues. And all plans offer the same Medicaid benefits and an extensive list of in-network medical specialists, behavioral specialists, dentists, vision care providers, all that great stuff that people may need. And when you're 12 years old or older, you are entitled to Medicaid Managed Care Insurance member, so ID card. So you get that actual card if you want that. And if you are Medicaid, enrollee, if you have that as your health insurance, you don't pay premiums, copays, or deductibles, and so you don't have to worry about that. Now, say you are somebody who used to be in care with us and you're no longer in care, right? What then, right? And in those instances, there's something called Transitional Medicaid. Transitional Medicaid is obtained through ACS, the Administration for Children's Services, and it's applied by your caseworker, your case planner. And essentially, it's a continuation of Medicaid until essentially 1 year after you get discharged. Don't worry, you could still reapply for Medicaid. You don't have to think that you're not going to have health insurance after a year, but essentially it will help you transition from the Medicaid through ACS to standard Medicaid if that is something that you need after a year. There are HSVS managed care liaisons who can help you navigate any sort of issue. So please make sure you're talking to your case planner. They can connect you to a specialist who can help you navigate any sort of issues that you're having. So health insurance coverage is very, very important for your overall well-being. If you don't have health insurance, it can really be very problematic. And it's available to you now and also in the future. So please make sure you're connecting to any sort of healthcare provider you may need, talking to your case planner, talking to your coach, talking to your health home worker, making sure that you kind of have what you need in terms of your medical needs and mental health needs and all that great stuff. So if you have any questions, my email will be in the description of this video, so you can always reach out. You can ask any questions you have, or I can connect you to a specialist as well. So thank you so much for listening. Have a great day.